Hello everyone, my name is Genesis Becerril and I'm going to be talking about poliomyelitis or polio. I got interested in this disease because I used to work for Rotary International, which is then responsible for the #1 initiative to eradicate polio worldwide. So I decided to look further into the disease to know what it's all about, what are the causes and the symptoms and the prognosis of this kind of disease. Poliomyelitis is a highly infectious viral disease which mainly affects young children under 5 years of age. The virus is transmitted person to person through fecal oral route, and less commonly it could be transmitted through a vehicle like food or water. It multiplies in the intestine and where it can invade the nervous system, and it can cause paralysis in a matter of hours. Poliomyelitis is an acute communicable disease of humans caused by enterovirus. The poliovirus attacks the nervous system, as I said, and it's incurable. However, it can be prevented. There's three main types of polio. One is the abortive polio, which is the mildest version of polio that can cause symptoms like fever, decreased appetite, nausea or vomiting, sore throat, and not feeling well all over, mainly. There's the non-paralytic polio, which has similar symptoms. However, it can also have some pain in the muscles, in the neck and the trunk, arms and legs, stiffness in the neck and along the spine. And there is the paralytic polio, which can cause the same symptoms that I mentioned for both the abortive and the non-paralytic polio, but also it gets the person might get muscle weakness, severe constipation, muscle wasting, weakened breathing, trouble swallowing, and muscle paralysis, because, as I said, it affects the muscle of the respiration. For polio, as I said, there is no cure. However, there are different treatments that can help the person infected with this disease. Things like pain relievers or muscle relaxants, usually the disinflammatory medication, or opioids. 1 in 200 infections lead to irreversible paralysis. Among those paralyzed, 5 to 10% of the children especially die when their breathing muscles become immobilized. In non-paralytic poliomyelitis, the prognosis it's a complete recovery. However, in paralytic poliomyelitis, about 2/3 of the patients have a residual permanent weakness. Bulbar paralysis is more likely to resolve in peripheral paralysis. Mortality is 4 to 6%, but increases to 10 to 20 in adults or in patients with bulbar disease. So that's what all the Rotary International Initiative is about, vaccinating young children so this can be prevented. Hopefully this was informative and helpful. Thank you.